So we're so involved with our patients that we've been told that they don't want to go home. They feel safe here, and they're scared to go home and be by themselves. They would rather stay in the hospital than discharge home. My name is Charla. I'm a case manager for intensive care unit at OakBend Medical Center.
And my name is Becky Bramer. I'm also an RN case manager on the Med-Surg unit.
Start with when patients come in, every patient is seen by a case manager. We assess them. We speak with their family members if the family members are available. And we've been told before, or we've been asked, does every patient get a case manager? Because I think the situation at some of the other hospitals have been, we didn't even see a case manager our whole visit. And that's so uncommon here because we're so used to seeing every patient that comes through the door.
And all patients may not need any sort of service from us, but we still see them and we still assess for that need.
Things that case management does that I don't think a lot of people realize, we're hands-on with the patient and the family from the moment they come into the door till the moment they leave our facility. A lot of services that we provide would be equipment they might need before they're discharged, discharged to places post-hospitalization if they're not quite ready to go home. We find the appropriate level of care for them after the hospitalization. We do follow up with them after they leave as well, just to see how they're doing and if there's anything else we can help with. We provide transportation for the patients if they need it. We set up medications anywhere from oral medications to IV antibiotics in the home. We work with home health to establish things the patient may need from home. Anything else, Beck, you want to add?
You pretty much covered it. We start assessing and discharge planning as soon as the folks hit the door, which can be disconcerting to people at times. And we're aware of that. But we do try to take a look at the whole picture and provide assistance where we can.
We deal with insurance a lot too. We help the patients and the families navigate through the insurance for approvals as well to get what they need.
Which a lot of times involves denials, and
then we have to come up with a plan B. Yeah.
But there's a lot that goes on behind the scenes as far as case management. We deal with insurance, we deal with discharge planning, utilization review.
Family support is a big one for case management as well.
Absolutely. What I was going to say is that the emotional support, that people don't realize it until they're in the situation, but many times emotional support and guidance means just as much as treating their physical illness.
A lot of times there's things that the family doesn't even think about because their mind is so consumed with what's going on with their loved ones. So even religious services, case management
chaplain services
reaches out absolutely to get them those services, to give them the support.
I would say, and not all situations are like this, but I really feel like when you can be present with a family and a patient at the end of their life, that's a very special time. It's really a privilege to be able to share that with the family and with the patient. Again, it doesn't always go like that, but as a nurse for many years, that's what means the most to me.
So we received a patient in ICU. He initially came into ICU, a paraplegic multiple wounds all over his body. Of course, he was septic. We were able to start with antibiotic treatments, treatment of the wounds. The patient, however, we found out initially was homeless. So from ICU, then he transferred to Becky on the medical floor.
And we continued treatment there for him with the IV antibiotics, wound care. He had several debridements done on the wounds. He ended up with a wound vac to help the wounds heal in a more timely manner. He also was receiving physical therapy. Discharge planning on this patient, however, was really hard because he was homeless. He had been injured in a, not a drive-by shooting, but a road rage shooting. Very little family support for him. So what we ended up doing is he continued to need IV antibiotics and wound care. So he transitioned to our skilled nursing unit. Insurance also was not going to be able to cover some of the treatment that he received. So with OakBend being a community hospital, and always we treat folks no matter if they have an ability to pay or not. He continues treatment there, and he will eventually be discharged to either a supported living facility or some other something, but at least he will have a place to go.